Hello, my name is Christina Jakob. I'm a registered dental hygienist and a Burst ambassador. Did you hear about the new recommendations for dental offices because of the novel coronavirus? We have to close our doors for preventive services and everything else other than emergency services. What does that mean for you? If you have a cleaning appointment in the next couple of months, it'll most likely be canceled. Our current protective gear doesn't filter out COVID-19, so we have to cancel anything that's not an emergency. Is it that big of a deal that you can't have your teeth cleaned? Well, here are some of the things we do during our cleaning appointment. We check the health of your gums. We do an oral cancer check. We take checkup x-rays, checking for cavities. We remove all plaque and calculus or tartar around your teeth and your gums to prevent gum disease, and we'll usually give you a topical fluoride treatment. So if you're one of the many patients who will have to skip their cleaning appointment, I want to tell you some things you can do at home in order to prevent cavities and gum disease. Gum disease affects all kinds of other health issues: heart disease, diabetes, plaque in your arteries, asthma, even erectile dysfunction. So it's really important to prevent it or to control it. Here's what I tell you if you were in my dental chair. First, brush twice a day using an electric toothbrush. They're proven safe and effective, and they're a lot of fun to use. My favorite is the Burst Sonic toothbrush. It has very soft, multi-layered bristles, so they reach in all the nooks and crannies to give you the best clean. The battery lasts for a month. It's a rechargeable brush, so a month on one charge, and you get a new toothbrush head shipped to your door every 3 months. Because the recommendation is that you change any brush that you have every 3 months. It's amazingly affordable compared to its competitors. The way to adapt it to your teeth so that it cleans your gums effectively is at a 45-degree angle towards the gums. So you would slightly turn it upwards towards the gums and then downwards towards the gums. Once you have it adapted correctly, you slide it slowly along the gum line, very gently. You hold it very gently and you slide it back and forth. It has a timer, so it lets you know when it's time to switch to the next quadrant, and it has a 2-minute timer to let you know when you're all done. This toothbrush, in a double-blind independent study, it's been proven to remove up to 10 times more plaque than your manual toothbrush. So incredibly effective. Also, you buy it online, so you can stay quarantined and not worry about going to the store. It always ships free, and I'll give you my discount code to get 40% off. Next is floss. I know, the dreaded word. But hang in here with me because I'll tell you about some other things you can do instead of flossing if that's not your favorite. Okay, so before you diss the floss idea, grab some floss and follow along with me. In case no one's showing you how to floss, because I hear that a lot when I show my patients, it might be easier than you think if you know what to do. So when you floss, you want to wrap some floss 2-3 times around the middle finger on your left hand, if you're right-handed. Then you roll it once around your other middle finger, and then you pinch the floss with your thumb and middle finger, leaving about 2 inches in between. Gently, in a back and forth motion, you slide it in between the teeth, and then, this is the most important thing, you form a C around the tooth, and you move it gently up and down in between the tooth and the gum. So slowly back and forth. Notice how far the floss goes under my gum. My gums are healthy, so this is normal. Then you move to the tooth next to it, and you keep on going. Not too bad, right? Now, you notice my floss is black. That's because Burst is innovative, and their floss is charcoal coated, so it whitens and it's antibacterial. It also comes in this nifty little reusable container, so they're environmentally friendly, and you get a new floss bobbin every 3 months, and you replace the empty one. So, good thing to know about flossing: if you haven't flossed in a while, your gums will probably bleed when you do this. That just means your gums are not happy, i.e. there's gingivitis, and you should floss again tomorrow. With flossing once a day, the bleeding will most likely go away in a few days, a week at the most. If it doesn't, please have your dentist check for gum disease as soon as you're safe to go back into a dental office. Okay, You're still thinking floss is not for you? Let me give you more options for cleaning in between the teeth. These little flossers, floss picks, they work okay, but they can't make that C shape I was showing you quite as well because they're not as bendy. So they're not ideal, but they're way better than nothing. A great option are these little interproximal brushes. CVS has a good store brand. They come in different sizes. You always want to get the smallest ones you can find. These are fantastic and easy to use. You just slide them in between your teeth. For most people, they'll only work between your back teeth. Front teeth are a little too close together, so I'd still floss those ones. So here's how you use these. You would just slide in between the teeth. Another option, even though it's more expensive and way messier, is a water flosser. I recommend using it in the shower because it just makes a mess. But it's very effective to clean in between the teeth, and it's easy to use. So we got brushing, flossing, now rinsing. I highly recommend a daily fluoride rinse. You can get these over the counter as a mouthwash. Just look on the label, make sure they contain fluoride. With mouthwash, if you have any problems with dry mouth, stay away from alcohol. Some of the most popular mouthwashes have very high alcohol content, which is okay if you don't mind the burning feeling and you don't have a dry mouth. With fluoride mouthwashes, in order for them to prevent cavities effectively, it's very important that you don't rinse or eat or drink for 30 minutes after you use the mouthwash, or the fluoride won't do its job well. So that's what I tell you if you're a patient in my chair. Please stay safe, step up your oral health game, wash your hands for 20 seconds with soap and water, and ask me all your dental questions in the comments.